Hi to all my Medihelp clients. Thanks for joining me on this quick video. I just want to let you know that there have been a tremendous number of changes to Medihelp for next year. So we've got quite a lot to get through. So let's get on with it. I'm just going to quickly take off the video so that we can save some bandwidth. So Medihelp have totally rearranged their product structures. Although if you are on a particular plan now, you just need to get used to, most of all, you need to get used to the new name. So when I go through the names, just make a particular mental note of the name of your particular plan and possibly the one that you're thinking of changing to if you are. All right, so the summary of changes: that they've repackaged their product range. They have new product names, new products, not totally new products, but they've added a few things. There's an overall contribution decrease for 2022. They've added some health incentives and they've also given us some benefit enhancements. So the new names, new plans, there have been some contribution reductions, but some have continued to go up a little bit, but I'll point those out to you on the next slide. So the overall weighted average price reduction is 0.45, but you'll, as we go through the next little bit of information, you will see that some of the products and some of the plans have come down quite substantially. So some of you are going to be smiling, others perhaps not as much. Right, so let's have a look. On the left-hand side, I'll just use my pointer quickly. You'll see the products for as we currently know them, and then for 2022, the new names. And then we just quickly go through the contribution adjustments that relate to that product. So there is a brand new plan called MedMove. This is for new entrants into the medical aid space. And I'll go through that specifically with you. Prime 1 and Prime 1 Network are now called MedVital and MedVital Elect. Where you see the name Elect, it means that you need to use a network hospital and a network doctor. So Prime 1 came down by almost 6%, and Prime 2 Network, or now MedVital Elect, came down by 2.86%. Prime 2 and Prime 2 Networks are the ones that have changed the most. You'll see Prime 2, or now called MedAdd, have now come down. It's come down by 9.38%, which is a huge reduction. Prime 2 Network, not as much, or MedAdd Elect, it's come down by 5.82, almost 6%. Unify has gone up a tiny amount of 2.39%. Your Prime 3 Network, now called MedPrime Elect or MedPrime, have gone up also a small amount, 1.95 and 2%, just over 2%. By the way, Unify is now called MedSaver. Right, my Prime 3 is now MedPrime. MedElite is easy to remember, because it's called MedElite, and also MedPlus for the old Plus product. Those have also gone up, not huge amounts, so they're still in line with inflation and certainly below medical inflation, which is what was requested. Right, Assess has changed its structure. It's no longer part of like an entry-level plan. It's actually now seen as a more comprehensive plan, but there is a student option, which is extremely well priced at 702 Rand. So I'm going to go through Assess specifically with you, and they have assured me that even if the results from Varsity or Technicon or Damlin or wherever you happen to be studying is late again and only comes out at the beginning of 2022, we can request that you move from Assess and you're not forced to continue with Assess even though it's after the 1st of January. Let's take a quick look at what they're calling the new products. I'm going to move to the right first with MedMove. This is the entry-level plan. You'll see there's unlimited GP network visits, nurse consultations and virtual care. Big push this year for people to use nurses when it's not that serious, and to also have a stab at this virtual care, seeing the doctor virtually, which is a lot less expensive and a lot less inconvenient than actually going to see the GP eye to eye, which is what we're used to. There are dental checkups and an eye test. They're just checkups, no treatment thereafter. there is some physiotherapy, and there is some acute medication, radiology, and pathology as part of this plan. Your added insured benefits, where you see the word insured, this means that the scheme pays for it, right? Also known as a wellness benefit or a wellness platform. You get your health tests, your flu, and your COVID vaccinations, and there are also some contraceptives included here. Looking at the hospital network, there is a network that you need to use. I can just as easily send that to you, or you can look it up on the Medihelp website. And where you have to go for a day procedure, and there are certain procedures they insist that you go to a day network for, you need to check that you're going to one in the network. Contributions are 1,552 Rand per month, 1,452 even, and all family members pay the same rate. So it's fine for a couple or a single or a couple, but once you start having children, this becomes an expensive option. So I wouldn't recommend it for anyone who's having children or has children. The Medihelp, which is the old Necess, is now network based only. You've got day-to-day benefits where they have, it's really like a traditional plan. They have a fixed amount for certain benefits. So for your healthcare provider network, starting at 3,000 Rand per member up to 7,000 Rand for a family. That's your day-to-day savings, and a separate GP consultation benefit from 2,100 up to 5,200. So you get 2 out of network GP visits, I believe, and it's up to 2,450. Well, I suppose once you've used up that amount, the dentistry and optometry benefits, so there's a separate physiotherapy benefit. Your added insured benefits is a full basket of the wellness benefits, including if you are having a child, including 12 maternity related consultations and baby benefits, health tests, immunizations and contraceptives. Care extender benefit, I will explain that now. It's a new benefit with Medihelp. Hospital network, please, you have to use the hospital network, but Medihelp do generally have a very good hospital network, certainly one of the better ones. And again, if there's a day procedure being done, you need to use that day procedure network. So students only pay 702 Rand, and members pay, for those earning over 800 Rand, starting from 2,226. So this is has always been my problem with Necess, the old Necess, is that you're on a student network, and then if you don't change before the first of the year, and sometimes it's hard to make that decision because you don't know if you've passed your exams or not, they suddenly shoot you up to 2,226, which is huge. So hopefully we've overcome that problem. So here are some of the new benefits that they were talking about. The care extender benefit, I want to point out specifically, where if you go and have one of these tests, like a pap smear, a mammogram, a prostate test, fecal occult blood test, easily said by using the acronym FOBT, or a bone mineral density test, you are going to get an extra GP visit per family. Also, if you go and have your normal checks done, blood pressure, GP, not the GP, I'm talking nonsense. Your blood pressure, your diabetes, sugar levels, your cholesterol, your HIV, all of those things, and your biometrics, you can get 450 Rand for self-medication. So they're encouraging you, bribing you actually, to do your checks, because obviously this is really important. It seems like such a simple thing, but it is really important to do it every year, so you can do early detection of any problems that you might be having. Also, there's a virtual care network that's been added. So by doing it, actually quite vastly increased your GP network, because you can see anyone virtually anywhere around the country. So those virtual networks and nurse visits are usually done through Clicks and Discam and any of the participating network pharmacies. There's your care extender benefit, which I've described above. Your special needs patients, they're now allowing them to have their dental work under anesthesia, because if they find it very hard to sit in a dental chair, so they might have some kind of muscular dystrophy, for example, or they might have a mental problem where sitting in a chair with a dentist badgering away at your teeth is not going to be doable. All right, so Med-Add, which is that new, sorry, it's Prime 1. There are new insured optical and conservative dental benefits for children under 18. And for the very top ones, they've now introduced they can roll over their medical savings to the following year, which is good news for those who like to do that. Hospital and day procedure networks. There are networks for day procedures and hospitals. So if you are on a network facility, please make sure, on a network plan, make sure that you use your networks. Otherwise, you're going to come up short and they might not even pay for your procedure. With the new products and the referrals, so please just get a referral. Just make it a habit that when you're going to see a specialist, you get a GP referral, because then you know for sure that you are not going to have to please explain why you didn't get a referral, and potentially they will not pay for you. There are contracted specialist networks, and what they're doing is they're trying to increase the number of specialists on that by including urologists and ophthalmologists. This is a long-term thing. It's not easy to contact all of these specialists and get them onto the network, but they are in the process of doing that. One of the best things about Medihelp, or one of the couple of things, is that first of all, you only pay for two children on the scheme. So if you've got 3 children or more, it is definitely going to be less expensive coming onto Medihelp. Also, students stay on child rates for the term that they are on, students up to the age of 26. And then if you choose a discounted option or a network option or an elect option, you do get a discount for agreeing to use the networks. There is a very nice e-brochure for the for everyone who wants to actually download this, and I think it's a good idea, especially with all the name changes and all the changes to the scheme. I'm not going to go through these in detail, but again, this would be on the brochure where you can select, let's say, Med-Add, which is your prime one. You can go and see what all the benefits are, and they go through everything. So there's your day-to-day benefits generally. Here are your core benefits, which is your hospital benefits, your emergency transport, for example, and then you've got your costs. So for a principal member on Prime 1, it's now 2148 with 324 saving contribution. And then if you are on Med-Add, which is Prime 2, remember this was the biggest reduction, you now have a premium of 2,598 as a principal member. There are care programs available. The back and neck program is excellent and will often mean that you don't have to go for a back or neck op. Very good results with the DBC or document-based care. So you can just register for that. Any chronic care program like high blood pressure, cholesterol, diabetes, it opens up a basket of extra benefits for you, and the HIV program. Right, so please, just a reminder that pre-authorizations are still your responsibility as the member. So please make sure before going to hospital or before going for a test, like an MRI scan, that you get a pre-authorization done, and you need to use that authorization number when you send the claim in. Right, so that's basically it from me. I thank you very much for attending and spending this time with me. You might need to come and chat to me, especially if you're a little bit confused about all the different changes. So please just make an appointment. I can also help you with help print and also getting your medical brochure onto your cell phone. So just give me a call and we can chat. Take care, guys.